Hello and welcome. This training is intended to provide an overview of the importance of maintaining the vaccine cold chain. Proper vaccine storage and handling begins with an effective vaccine cold chain. The vaccine cold chain, as defined by the CDC, is a temperature-controlled environment used to maintain and distribute vaccines in optimal condition. Temperature conditions outside the acceptable range can break the vaccine cold chain and impact vaccine viability, resulting in reduced potency or total loss. The National Institute of Standards and Technology, NIST, conducted a study for the CDC which estimated that 14 to 35% of vaccines are subjected to inappropriate storage temperatures as they travel through the vaccine cold chain. This flowchart outlines every point in the vaccine cold chain, from manufacturer to patient, and highlights the provider responsibility, including receipt of vaccine, storage and handling, and vaccine administration. Vaccines must be stored properly, from the time that they are manufactured until they are administered. Viability is reduced every time a vaccine is exposed to an improper condition. This includes overexposure to heat, cold, or direct exposure to light at any step in the vaccine cold chain. And once lost, vaccine viability cannot be restored. One of these vaccine vials in the image on this slide was left out of the refrigerator overnight and then replaced in the morning. Can you tell which vial it was? Of course not. Vaccine appearance is not a reliable measure for determining vaccine potency or viability. Temperature recording and data review is the best measure for tracking and identifying possible temperature excursions and determining impact on vaccine potency and viability. All temperature excursions, regardless of duration, must be reported to the New York State VFC program immediately at vaccinetemp@health.ny.gov. And as a reminder, any out-of-range temperature must be reported, regardless if the alarm was triggered. Inventory counts can put vaccines at risk for exposure to out-of-range temperatures. Consider working on one shelf at a time throughout the day to avoid the door being open for too long at one time. Make sure vaccine products are well organized and stored upright in their original packaging, as vaccines stored in their original packaging have reduced exposure to light. It is important to ensure that the vaccine storage unit doors are closed after each use. This can be difficult in a high-traffic office with various staff in and out of the storage unit. Consider using Velcro or other door latches, door alarms, or self-closing units to prevent doors left ajar. If overcrowding is a concern for your storage units, you may be required by VFC to purchase additional units for your vaccines. Please refer to the size chart in training number 5 of this series. If necessary, vaccines can be stored off-site in accordance with your emergency vaccine management plan until an additional storage unit is purchased. Only trained staff should be responsible for adjusting the storage unit thermostat. Consider attaching instructions for proper thermostat adjustments and settings to the unit for reference. If an emergency vaccine management plan is not activated during a power outage, vaccines can quickly become compromised. Staff should be adequately educated about timely emergency management. VFC providers should implement their emergency plan if a power outage is sustained or anticipated to be more than 2 hours. Use of continuous temperature monitoring that is connected to an alarm system ensures that providers will be notified about any temperature excursions occurring after hours. Frost buildup can hinder proper door closure and airflow. Freezers which require a manual defrost should be defrosted regularly. Frost-free freezers are recommended. Continuous temperature monitoring devices, known as digital data loggers or DDLs, support vaccine cold chain management and are a tool for identifying problems with your storage unit. DDLs also allow for review of past temperature data to track out-of-range vaccine storage temperatures, also known as temperature excursions. Vaccines exposed to cold chain interruption and/or failure may become non-viable. Administration of any of these doses to patients means they are not fully protected against vaccine-preventable diseases and are recommended for re-immunization. This can affect herd immunity and can negatively affect the patient's and the public's trust of vaccines. Additionally, there are also increased costs associated with vaccine cold chain failure, including costs associated with replacement of the wasted vaccine, time spent reporting the waste, reporting any excursion that may have occurred, contacting the vaccine manufacturers, and time spent contacting and scheduling patients for re-immunization. Not only is it considered a best practice to store vaccine in standalone storage units, but it is a requirement of the New York State Vaccines for Children program. Proper setup of these units is fundamental in maintaining the vaccine cold chain. This includes ensuring the appropriate temperature range is set, storing vaccines away from the walls of the unit, with proper spacing allowing for airflow, and in original packaging when possible. Vaccines should only be stored in bins that are well vented, shallow, and either plastic or wire. The New York State VFC program requires the use of calibrated continuous temperature monitoring devices, also known as digital data loggers or DDLs. DDLs are devices that continuously monitor, record, and store temperature data. Data can then be downloaded and reviewed to support cold chain management. And many DDLs offer alarm systems that can be utilized to prevent or interrupt temperature excursions. As discussed in previous trainings of this series, the New York State VFC program requires that every enrolled provider develop detailed and comprehensive routine and emergency vaccine management plans. These plans must be reviewed at least annually, and anytime storage and handling recommendations and/or guidelines are updated. Any updates to your plan must be reviewed with all staff involved in vaccine management. Any other staff or persons with access to your vaccine storage room or electrical panel should be aware of emergency contacts in the event of a power loss or other incidents affecting your vaccines. Successful cold chain maintenance is not possible without well-trained staff. Any staff who handle or administer vaccines should receive training, including front desk staff who accept vaccine shipments or assist with unpacking vaccine deliveries. Staff should review training annually, when program or vaccine recommendations are updated, or when new staff is hired. Training should cover vaccine cold chain management through best practices for storage and handling, temperature monitoring requirements, and use of temperature monitoring devices or DDLs, and an overview of out-of-range temperatures and how to report excursions. Training should outline the requirement to record minimum and maximum temperatures when the office first opens for the day. As referenced earlier in this training, CDC's Vaccine Storage and Handling Toolkit brings together best practices from ACIP's General Best Practice Guidelines for Immunization, product information from vaccine manufacturers, and results of scientific studies. Implementing these best practices and recommendations will help protect your patients, safeguard your vaccine supply, and avoid the unnecessary costs of revaccinating patients and replacing expensive vaccines. This toolkit, linked here and included in the resources document provided with this training, provides information, recommendations, and resources to assist you in properly storing and handling your vaccine supply. The key messages from this training on the vaccine cold chain begins with the understanding that the vaccine cold chain is a temperature-controlled environment and flow that begins with the manufacturer and ends with the administration of the vaccine. Interruption in the cold chain or total cold chain failure can lead to patients receiving non-viable vaccines, reimmunizations, and financial loss. This can also negatively affect public trust of vaccines. Vaccine cold chain management is largely supported through the use of proper storage units and temperature monitoring devices and well-detailed routine and emergency vaccine management plans. Finally, well-trained staff successfully implement and execute policy and procedures to maintain the cold chain. Thank you for your participation in this training on the importance of the vaccine cold chain. As always, questions can be directed to NYVFC@health.ny.gov.